Yeah, so, I say this about every ASH actually, and it's true because these meetings are so exciting and there's so much going on. And I was a little surprised that myeloma was pushed into not one of those big halls, and there was trouble with people getting into the room. So this meeting is, I think, the biggest take-home message is it was all about bispecific T-cell engagers. In addition to what I just told you about with the Elranatamab, other bispecific T-cell engagers are being presented. So we saw really nice data with Talquetamab, which was presented. It's also published in the New England Journal of Medicine. Completely novel target using GPCR5D. Really high response rates, good durability of response. So I'm excited about that. I am a little bit concerned about some of the toxicities such as dysgeusia, as well as the nail changes, skin changes, I think are manageable. So we'll have to see where this fits in the context of myeloma. The other one, which is a bispecific against FcRH5, Cevostamab, that's also being presented at this year's ASH meeting. Again, the more novel targets we have, the more options we have for our patients. To me, that's extremely exciting. Again, along the theme of immunotherapies, we have data on CAR T cells. We have earlier data. So KarMMa-2 data is going to be presented. We'll have to see what these are patients who progressed right after a transplant. So to offer them a CAR T cell early on is something which is absolutely essential, because these are truly high risk. Even if they didn't start off with high risk, the fact that they progressed within 18 months makes them biologically high risk. So doing something novel for them is critical, and we've seen an exceedingly high response rate with ide-cel, which as of right now seems to be maintained. So that's exciting as well. And then there is other CAR T cells with other targets. We have a GPCR5D CAR T cell being presented at this meeting. So I think it's exciting with all of these novel therapies, all of these quadruplets. I think the future for myeloma, for me, very bright, and it's a good thing for our patients.